And shout out to my followers, BN and her friends. I hope you guys are doing well. And thank you guys for the support and good luck with all your endeavors. I'm going to be talking about carpal tunnel syndrome, that condition where you have numbness and tingling on the palm of your hand. I was compelled to do this because I did a presentation to my elementary school teachers in the Philippines. Shout out to St. Scholastica's Academy, Bacolod City. And one of my teachers asked me about carpal tunnel syndrome, wanted to share this video with her and also everyone who's affected by this debilitating condition. The main nerve that's affected here is called your median nerve. That median nerve is arguably one of the most sensitive nerves in your body. And just a historical reference, that's why it was so painful when they would torture people back in the day, when they would nail them to the cross, is because the median nerve gets nailed. And that's so excruciating. This video is going to be geared towards discussing the structures that are involved during carpal tunnel syndrome and conservative treatments on what you can do to help yourself. Carpal tunnel is a compression neuropathy. Compression meaning you're compressing the nerve. So one of the telltale signs is numbness and tingling or pain on the palm of your hand, on your thumb area, and then to your pointer finger, and then to your middle finger, and then half of your ring finger. You may also have weakness of your grip strength. It's called carpal tunnel because you have a tunnel here, guys, on your wrist. The roof of that tunnel is a ligament. Ligament basically connects bone to bone. And then underneath you have wrist bones. What goes through that tunnel is your median nerve. Think about cars passing through a tunnel. So if that tunnel gets compressed or the circumference gets smaller, it's going to irritate that nerve. And that's what causes pain, numbness, and tingling and all those symptoms that you may be experiencing. Some tests that I do to figure out whether a person has carpal tunnel syndrome or not. Number one, I put them in this position and then I have them hold it for about a minute, and then usually for severe cases it already arises. Even as they do this, they're going to feel it right away. I tap with their wrist like this, that way that compresses the nerve. And I also look at the bulk of the muscle to compare it to the other side. More than usual, people who have severe cases of carpal tunnel syndrome, their muscle bulk is not as big because their muscle becomes smaller or it atrophies. Sometimes I test the strength of the thumb because the median nerve also helps with the movement of your thumb as well. I would do the filament testing where I test the sensation of the hand, and if all those are positive, then the likelihood of them having carpal tunnel syndrome increases exponentially. For wrist, guys, when you go like this is called a neutral position. This is least irritating on your nerve. But if you go up like this or down, right, extend and flex for prolonged periods, that's going to create pressure in your median nerve. And that's why when you're typing a lot, when you're doing this, or when you're knitting, when you expose your wrist to constant stresses like that on an everyday basis, or gripping things too much, that's going to eventually irritate your median nerve. So when you set up your work environment, you need to make sure that at least your wrists are in a neutral position. For example, your keyboard's going up like this. Eventually, you're not going to feel it in the beginning, but the more you do it, you're going to eventually feel sensation or symptoms or the things that you feel because you're always exposing your wrist in these positions that are very irritating or aggravating to your median nerve. Make sure that when you type, you're typing in a neutral position. And number two, you're not compressing the bottom of your wrist here. Even if it's just like a tiny load, if you're hitting your wrist on top of your hard table, and that's going to irritate it. The third one is that when you grip things like this too much, if you open all these jars or when you're holding something, you're using tools in your garden, you're using vibratory tools, you're using the shovel, you're digging holes, you're doing a lot of things of that nature where you have to use your grip strength a lot, that's also going to cause a lot of stress in your median nerve. So make sure that at least when you're working, I would recommend using padded gloves. That way they're not putting a lot of pressure on your nerve. And also when you use objects, I would suggest using bigger handles. That way when you grip, it's wider. You're not fully clenching your fist. In turn, reduces the stress on your median nerve. You can also use a splint or a brace that puts your hand in a neutral position, straight. This will definitely help you when you sleep at night. When you sleep at night, guys, I would recommend you putting your arm, or you sleep in this position here. That way you're not putting stress on your wrist. And it would be very, very good if you can get a splint or a brace that you can ask your physical therapist what he or she recommends. And that way your wrist is in a neutral position. And at the end of the day, guys, what's really important is that you get injured because of the wear and tear and the stresses that your nerve is put upon. Usually people get injured because of capacity and load. This is a very important concept to remember. Capacity just basically means how much your body can take the stress that is put upon it. And load means that how much stress is put on your body. So if your body's capacity is, say, I'm just putting an arbitrary number, 50%, but the wear and tear and the stress that putting on your body is like 70%, of course, your body cannot handle the stress or the load, which results to injuries. What I'm showing you right now to decrease the load, that way it matches your capacity, or reduce it even lower, that way your body is not in a lot of stress. So the first line of defense is conservative treatment. Everything that I've mentioned, such as setting up your workspace environment, you're not gripping things too much. If you're knitting 4 hours a day, maybe you can knit down to 2 hours. And if you're opening things, you can buy bigger handles, you could use padded gloves, you can use the splint. When you sleep at night, you can position yourself where you're not cocking up your wrist in this position. Also very important is that you're not sleeping on the side where you have your dysfunction, where you have your injury. You're putting your wrist and the side of your arm in positions that are compromised, which can irritate the nerve. So I would advise you to sleep on your backs, or maybe sleep on the other side of the injury. If your job is what caused you to be in this place to begin with, you're a guitar player or you're a pianist, or you're using your hands a lot, then I would recommend you to slow down and hold off on those a bit. Also, there's other things to consider, such as diabetes, hyperthyroidism, obesity, which you can discuss with your physical therapist or your doctor. Generally, women are more affected than men, and women above the age of 50. As far as surgery, I would start with conservative treatment first. I would seek help with your physical therapist. That way he or she can teach you ways on how to manage your carpal tunnel syndrome. If you don't get better after 3 months, and then the last thing that you can consider is surgery. If conservative treatment didn't work for you, nothing worked at all, then I think surgery can be part of the discussion. Steroid injections are corticosteroids. It's a substance that reduces inflammation. So give this a shot, reduce the load, reduce the amount of stress that you put in your nerve, sleep with a night splint, everything that I've mentioned today. If you have any questions, feel free to shoot me a comment, like this video, subscribe, ring the bell, and share this with your friends and family. My name is Dr. Kyle. Take care, be safe, and I got your back. And happy Mother's Day this coming Sunday. Bye, guys.